carotid artery occlusive disease. That's when there is cholesterol plaque buildup in the carotid artery, which is the artery that supplies blood flow to the brain. And the reason we worry about this is if the plaque buildup is significant enough, it obstructs the blood flow to the brain, and little particles can form on the plaque and then embolize off and lodge into the branches of the brain, and you can have a stroke. So if the patient is having symptoms of a stroke, or TIAs, which is a transient stroke, a transient ischemic attack, then we'll usually recommend restoring normal blood flow through the carotid artery. Traditionally, that's done by a procedure called carotid endarterectomy, which is done by a vascular surgeon in the operating room. And that's where the surgeon goes in and makes an incision in the neck, cuts out the cholesterol plaque with a little spatula, and then closes the artery up. Now, there's newer minimally invasive techniques, which is what the carotid stenting procedure is, and that's a procedure that I do. And in that procedure, we puncture the femoral artery in the groin under local anesthesia, and then under x-ray guidance, we pass little tiny catheters through the bloodstream up into the carotid artery. Now, the first step of the carotid stenting procedure is to place a filter in the carotid artery on the brain side of the carotid artery, and that filter will still let blood continue to flow to the brain during the procedure, but if any particles break free during your intervention, they'll get trapped in the filter. So after you put the filter in, the next step is to perform an angioplasty, where we put a balloon in and stretch open the narrowed area of the carotid artery, and if any particles break free, they'll travel with the blood flow and get trapped in the filter, stopping before they reach the brain, so you won't have a stroke. This next step is to place a stent, which is a tubular metal scaffolding that will stay in the artery and hold it open. The body will cover the stent with a thin tissue over the next month or two, so that it won't be a bare metal stent anymore, but it'll actually have some healed tissue. Following the stenting, we go in angioplasty with a larger diameter balloon and really stretch the stent open. And then the final step in the procedure is to go retrieve the filter and pull it outside the body, along with any debris which was unintentionally trapped in the filter during the procedure. And then we'll just put some pressure on the femoral puncture site and observe the patient afterward.